Finding out you have a liver cyst can sound scary, but most of the time, it's not something to stress over. Simple liver cysts are common, especially as people get older, and they usually don't cause problems. If the cyst is smooth, filled with clear fluid, and shows no unusual features on the ultrasound, you don't need any follow-up scans. This is true no matter how big cyst is. Doctors usually advise against routine checks for these types. Now, if the cyst shows anything unusual, like having walls inside it, thickened areas, calcified spots, or it looks uneven, then that's a different story. These details could mean the cyst might be something more serious, like an infection or a rare kind of growth. In those cases, you will likely need more detailed scan, like CT or MRI, to look at it more closely and decide what to do next. Also, if the cyst is causing problems like pain, feeling full quickly, or affecting how nearby organs work, then it may need to be treated. Treatment could mean surgery or draining the cyst and sealing it with a special fluid. The good news is that both approaches usually help and people generally feel much better afterward, although the cyst can sometimes come back. Interestingly, the size of the cyst alone doesn't matter as much as people might think. Even a large cyst doesn't need to be monitored if it's not causing symptoms and looks like a typical simple cyst on the scan. It's more about how it looks and whether it's bothering you than how big it is. Finally, if the cyst is thought to be part of a different condition, like a parasitic infection or genetic liver issue, then it's handled differently. Those situations follow separate treatment plans, so it's important to get the right diagnosis first before jumping into any decisions.